All right, so today we're going to walk through the procedural steps for the Solyx single incision sling. First, we're going to start by making marks on the outside of the patient. These marks are going to be roughly 3 centimeters laterally from the patient's clitoris on both the patient's left and right side. These marks are going to help us to identify the angle in which we want to place this mesh, which is going to be a 45-degree angle placement within the body of the patient. And these markings are also the indicators you would use if you were to do an outside-in transobturator sling. So once you've made your markings on the outside of the patient, you can make a vertical incision at the level of the mid-urethra. This vertical incision is going to be 1.5 to 2 centimeters in length. This mesh is 1.1 centimeters in width, so we want to make sure that we create enough space for the mesh to lay. From there, you'll dissect bilaterally at a 45-degree angle to the back of the inferior pubic ramus. You're making, at that point, a dissection plane so that your mesh can lay flat, or not lay flat, but lay at a 45-degree angle within the patient. So then, once you've created your dissection plane, you're then able and ready to grab your Solyx trocar delivery device and mesh. You'll then use the trocar tip and place that within the mesh carrier. You'll ensure that the steel tip of the trocar protrudes just out of the carrier, and also ensure that the mesh is placed on the posterior side or bend of the trocar. From here, there are 3 steps that I'd like to emphasize on the procedure. What we're trying to essentially do is we are trying to penetrate with the trocar through the periurethral tunnel or tissue. We are then wanting to get around the inferior pubic ramus, and then from there we want to insert the trocar into the obturator internus muscle, or the utmost portion of the obturator internus or obturator foramen. A few things I want to point out on the trocar: this white portion of the handle, these arrows pointing on this side, and then also the midline marker on the trocar. So we'll go ahead and start with step 1, and we're going to start with the patient's right side. So we're going to use our left side. We're going to have the trocar in our hand with the white facing up, and then we will go ahead and insert the trocar at a 30-degree angle into the incision and into the periurethral tunnel. At this point, we want to make sure that we are inserting at a 30-degree angle. The reason for that is we want to be parallel to the inferior pubic ramus, which is at a 30-degree angle. We also want to be parallel to the floor. So we'll go ahead and insert. We can use the index finger and thumb, if you'd like, from your other hand to have a controlled depth. You'll also want to use the mark on the trocar as an indicator. It's very critical. The distance from the incision to just past the bone is very consistent. This midline marker on the trocar will give us a visual cue that we haven't gone too far past the inferior pubic ramus. So we want that visual marker to just go beyond the incision. Once you feel that you've passed through the periurethral tissue and you felt that pop, this is when you'll then switch hands. You'll grab the trocar with your opposite or right hand. You'll switch the trocar all the way over to the patient's contralateral side, as far as it will go until you can't go any further. This here is going to put our trocar in a position where it's perpendicular to the obturator foramen, which is our target. From there, we're going to rotate our trocar at a 45-degree angle. This will put the arrows on the trocar facing and pointing in the trajectory that we'd want to place the anchor of our mesh. From here, once we have that placement at 45-degree angles, we will then use our index finger and thumb to control and guide our trocar into the obturator internus muscle. Once you've done that, you'll feel a pop. You feel secure. You can then release the mesh from the trocar by grabbing the trocar collar, stabilizing that, and using the right hand to pull back on the trocar. So it's secured, using the collar to stabilize and pull back. From there, you would be able to grab the mesh, do a slight tug and pull to ensure that it is stabilized and positioned into the obturator internus muscle. If so, you can then use your trocar. You're going to reattach the opposite mesh anchor to the trocar tip and do the 3 steps repeated on the opposite side. So I'm going to go ahead and grab that, attach the mesh, make sure that it does not get wrapped. Well, now we're going to be on the patient's left side. You'll be able to insert the trocar at a 30-degree angle, again, parallel to the inferior pubic ramus on the patient's left side. Trocar parallel to the floor with the white portion of the trocar facing up. You'll guide with the opposite index finger into the periurethral tissue. You'll feel a pop. Once you feel that give and you can visually confirm that your mesh midline marker is just past the incision, you'll be able to then switch your hand over to the contralateral side until you cannot go any further, putting your trocar positioned in a perpendicular plane to your target, which is the obturator internus muscle. And then from there, rotating at a 45-degree angle up, now having the trocar arrows pointing in the trajectory where you'd like to have your mesh anchor placed. You can then use your fingers, hold this placed, insert it into the obturator internus muscle, feel that second pop. Once you feel that and feel secure of your mesh placement into the obturator internus muscle, you can now, with one hand, secure the collar of the trocar, and with the opposite hand, pull back on the trocar. Once you've deployed the anchor into the muscle and released the trocar from the anchor, you're then able to visually confirm that the mesh is laying just flat under the urethra. And that would complete your Solyx single incision procedure.